Hey there, I'm Dr. Joanna Fong-Isariyawongse. I'm Associate Professor of Neurology at the University of Pittsburgh. I practice both sleep medicine and epilepsy. And today we're going to talk about something that doesn't get enough attention, and that's sleep and epilepsy. We put this module together because sleep really is a game changer for seizure control, but yet it is often overlooked. When you think about it, poor sleep makes seizure worse, and epilepsy cells can disrupt sleep and worsen sleep. It's a vicious cycle, but the good news is we can break it. This video is a companion to our guide on healthy sleep habits for patients with epilepsy, and I'm here to give you the quick and practical version of how we can practice good sleep habits. So let's dive in. Did you know that sleep and epilepsy have a bidirectional relationship? It's actually very fascinating. Certain sleep stages, especially non-REM sleep, can actually enhance or increase seizure activity, including interictal epileptiform discharges, while REM sleep seems to suppress it or protect it. Many people with epilepsy experience more seizures at night or during transitions between non-REM sleep stages or between non-REM to wakefulness. On the flip side, epilepsy cells can also disrupt sleep. Frequent nocturnal seizures or nighttime seizures, side effects from medication, they both can make it harder to get quality sleep. And we know that poor sleep and sleep insufficiency or deficiency can actually make seizure control worse. It's a cycle we definitely want to break. So, what are the most common sleep disorder in people with epilepsy? Well, insomnia is a big one. Many people struggle with falling asleep or staying asleep. So, insomnia doesn't have to be just about difficulty falling asleep, but it can be a struggle with staying asleep. The second is obstructive sleep apnea, is really common, affecting 1 in 4 adults. Then we have excessive daytime sleepiness or excessive sleepiness, which is sleepiness that is beyond what is acceptable. And we know that poor nighttime sleep or even side effects from anti-seizure medication can actually provoke daytime sleepiness. So I think it's really important to recognize these sleep conditions because they are critical to help patient with epilepsy to have better seizure control. We can use simple screening tools like stop bang questionnaire or Epworth sleepiness scale. They can help to screen for sleep apnea with stop bang and the Epworth sleepiness scale to help identify people with excessive sleepiness. As clinicians, I think it is important to start a conversation with your patients rather than simply saying, you need more sleep, you need to go to bed earlier. I think making sleep relevant is so important. Tie sleep to what matters to them, whether it is better grades, better sports performance, better skin, better mood. Connect sleep to their goals, makes it way more meaningful and impactful. And then for your patient who are still in high school, the most challenging thing for them it is the early school start time. Um, uh, in our country, high school start time is way too early, oftentimes before 8. And the recommended school start time should be no earlier than 8:30. And as a result, they just don't get enough sleep. They don't have enough sleep opportunity. It's not just about they using the device. It makes it worse, yes, but the school start time is way too early. So I would suggest for your patients to advocate later school start time to their teachers, to their superintendent, to the school boards, because I think that is very important for them, not just for epilepsy control, but for their overall well-being. Now, with daylight saving that comes in March, we're all going to lose an hours of sleep. And it's not just about the lost sleep. Waking up in dark means missing that important sunlight, which again helps with mood and alertness. So for people with epilepsy, this shift can make seizure control more challenging. So the best thing you can do is start adjusting sleep schedule little by little before the clock change by 15, 30 minutes each day rather than that 1 hour chunk all at once. For people with epilepsy, prioritizing sleep can be a game changer for both seizure control and overall well-being. As epilepsy specialists, we play a key role in educating patients about the impact of sleep on seizure management. Encourage healthy sleep habits should be part of the routine epilepsy care. And for those living with epilepsy, don't hesitate to talk to your doctor if you're struggling with sleep. It's an essential piece of the puzzle for better seizure control and overall health. Want to learn more? Check out our full companion guide for deeper insights and practical strategies. Thanks for watching and take care.